So when a patient walks in with a complaint of fatigue, I kind of really do discuss with them upfront. Fatigue is complex. It's one of probably the more nuanced and complicated symptoms that patients bring to us here in clinic. And so, I try to frame it as, it's a symptom, and my job is to help you uncover a symptom of what. So we kind of take a really broad look at a patient. What are your daily activities? What are your sleep patterns? What are your chronic medical conditions? What medications are you on? And then, of course, we'll finish with a thorough exam. But really, the short answer is there isn't one for fatigue. And so that's where speaking with a provider, coming and seeing me in clinic can really perhaps give you some good insight and good answers into a symptom that, isn't so simple at first glance. Stress is such a major part of so many medical conditions and symptoms that we don't even realize. And I think we're starting to understand more about that mind-body connection and how that can really impact not only things like fatigue, but our overall health. I would say that being really upfront with a provider about different stressors and things and habits in your life is going to make the picture so much clearer for me as far as kind of how I can tease things out and how I can kind of help you as we kind of start your evaluation. So if you're concerned that your fatigue is the sign of, a bigger problem, maybe a more serious medical diagnosis, that's definitely something that I can help you with. And that's kind of where I'm going to put in a shameless plug for getting your age-appropriate cancer and other healthcare screenings updated. Because if I can look in a patient's chart and say, well, your mammogram is up to date, your colonoscopy is up to date, your pap is up to date, then I know that, those potential causes for a symptom are much, much further down on the list. So the more you can do to stay up on your routine health maintenance, routine health screening, the better picture I'll have at kind of determining where your fatigue, kind of where we go from there.